You hear acne and you think teens, right? But according to some estimates, nearly 50% of adults still deal with acne-related skincare issues. Dermatologist Jeannette Graf is here with the latest research and the latest treatments. Welcome back, doctor.
Thank you. Good to be back.
Good to have you. We do think teens when we think acne, but you say it's become a chronic issue among quite a few adults.
That's right. And what happens is that it really starts in your teenage years, but it really, in 50% of cases, continues into your adult years, and adults suffer from it. So it really is a chronic condition.
How is it different from teen acne?
Teen acne tends to be accompanied more by oily skin. As you can see, adult acne tends to have drier skin, sometimes combination, red bumps. The red discoloration tends to stay around longer because adult skin doesn't heal quite as rapidly as teen skin.
You've made quite a few breakthroughs in treatment. One is Isolase, and this is brand new. What is it?
Isolase is truly it's a breakthrough. It is the only FDA-approved laser for the treatment of acne, and it combines two things. Vacuum, so it vacuums out all the stuff in the pores, and then it shines a laser light, which actually kills the bacteria that causes inflammation. And it has a better effect also because it also diminishes redness. This is an extreme picture just to show you how effective it is. Most adult acne is not this severe, but you can see it helps the redness, it helps the breakouts.
How many treatments would you need?
You'll see a difference after the first one. Actually feel quite good. It's painless, but about 5 treatments.
And it's expensive?
You know what? It's really not if you consider what you would pay for prescription medication and over the counter. It costs anywhere about $300 to $400 per treatment.
All right, let's talk about more traditional treatments like Retin-A. Is that still used?
Oh yeah, absolutely. Retin-A is a mainstay of treatment. It gets that first step in acne, very important. Teenagers can tolerate it better because it can be drying to some patients. The newer generations of retinoids or vitamin A's combine a retinoid with a topical antibiotic, and they tend to be less drying, which is important for adult skin.
If you have a minor case of adult acne, are there some at-home products that you can use?
There are so many. The #1 treatment that you want to use for adult acne is salicylic acid. Salicylic acid is super important. It is not drying. It's really good for skin, so you can use salicylic acid.
This is just sold over the counter in many products?
Over the counter, many products, readily available. You can use the spot treatment with benzoyl peroxide. Benzoyl peroxide, of course, is a spot treatment. It can be drying, so you have to be careful with it. You can do exfoliation, which is a very important part because you want to get rid of the dead skin cells that clog the pores. So you can use a microdermabrasion kit gently, or an at-home peel or exfoliation. You can actually buy acne kits. And the other thing that I like to talk about with adults especially is, it can be, activated by hormones, by stress. Stress actually increases oil production. And diet is very important because there are new studies that show that milk and dairy products and refined sugar products actually can worsen acne. So do watch your diet.
And we should mention ever so briefly, Accutane has been pulled off the shelf, but it's not because it's not safe. It was just a business decision.
It was an absolute business decision.
Okay.
There's no safety issue. It is a very important drug. It is available. There are just so many generic alternatives that the company decided as a business decision.
All right, Dr. Jeannette Graf, thanks.
It was so nice being here. Thank you.
Thank you. We'll put all this information, of course, on the website, earlyshow.cbsnews.com.